Hello dear friends, I'm happy to present you our new video dedicated to tooth preparation. This time I will be showing you upper canine prep from palatal side using depth scaling bore to create space for restoration. This video was filmed during our hands-on course, so I'll be sharing this video with you with a great pleasure. Don't forget to put likes, to share this video with your friends and to sign up to our YouTube channel. Enjoy! Depth cutter from the palatal side. We discussed with you many different possibilities, but I will show you now this one. This is 0.5 millimeters. It has limitation because of its design. Still, step one, the speed will be 100,000 RPM and more. In my case, it's like 170,000 RPM. You can use this bore in vertical mode and you can use this bore in horizontal mode. I prefer horizontal mode because sometimes when you do vertical, you do not pay enough attention to these transitional ridges and you may have under preparation there. When you do it horizontal, you cut it also. So we cut transitional ridges to get space for dental technician. Then you can have your vertical cuts if you want on incisal area. Now we're in Saudi Arabia. Instead of water we have oil in our handpiece, you see. we use the depth cutter in concave part. In concavity. The convexity here I will be prepping with another bore. So this is how it works. Okay, then after making these grooves, you take pencil, you mark it, and now we will take football. And with a football bore you have to be super careful because a football bore is very aggressive, and if you will work with football bore improperly, you may really over prep. So first of all, what you have to be careful with is apical inclination. If you will have apical angulation or inclination of the bore, the tip of the bore will start working and you will make a biggest finish line in the history of dentistry. Okay, so instead of moving bore down or apical, you have to incline it in other way, more to coronal. So it's better also to start from the incisal part. So I incline my bore more incisally and I will work with convexity of the bore. And then progressively I'm moving bore down, working by convexity. I want to avoid prepping with this bore using its tip. I don't want. The tip will start touching the tooth. It's normal. It's design of the bore, but it will be like a light beveling instead of using the tip completely. It will give you some slight bevel, which you can consider as the beginning of the palatal finish line. Okay, so that's it. Then we take bore 14 or 16, still not red, it will be medium grit. I will take 14 at this moment because I will do my marginal improvements during step 2 with a red bore. So I use this one and you place this bore parallel to the area that you are going to prep. So that's cingulum. By the way, the best place for your finish line from the palatal side, if you do metal-free ceramic bonded restoration that you can really bond, we do not rely on mechanical retention too much. In such a cases, we rely mainly on bonding. You don't need to go to the gum area. You don't need to get this straight component that is considered to be mechanical retention. We don't need that. So we can really start making our margins at the beginning of the convexity. If there is no caries, no filling, nothing, you can really do your supragingival preparations from the palatal side, which you can consider that this type of restorations are semi-crown or three-quarter crowns, not like a full crown, because you are not covering the whole piece of the tooth. But if you have patient with a caries here, probably you will have to move this way, or you do metal ceramic crown and you need this vertical component, so you'll have to go here. And if you have patient with a deep bite and the occlusal points will be somewhere here, and you will want to redesign these occlusal points, then probably you will have to include this area into your preparation. So I will do it supragingival. Half tip of the bore will be utilized, and I place bore parallel to convex zone, and now I join it with the mesial transition that I can see from proximal preparation that we did yesterday. Now I join it with distal transition. Let me zoom in so you will see better. So that's the notch from the bore that I made yesterday, prepping proximal side from buccal perspective. So this is the way we join it, and the same here with the mesial. Everything is fine now except the whole control of the insertion path, and I cannot be really sure that I made a very good transition from palatal to mesial, for example. So in this case we will have to work with mirror. So now what will happen? I will move patient's head down, so chin goes down. Then I move my microscope forward. I take mirror, and I will place mirror as far as I can. So basically I can put mirror to the chin area when I work on the upper frontal teeth. I move microscope also to the same way where the mirror is, so now I can see mirror. Then I move mirror to get any kind of view over the canine. Position microscope the same way. Then I zoom, and I focus, and then I can zoom. And now I can control, better all these transitions. So I hold my mirror away as far as I can again, and that will keep me working with handpiece, so I have space for the handpiece, and also the mirror will be almost dry because it is pretty away from the water spray from the handpiece. To make it more dry, your assistant may help you with a high volume suction, and the high volume suction will be placed from the buccal side, for example, from here. So all the water spray from the handpiece will be evacuated by the suction. Okay, so that's the way I hold this mirror. The mirror is not, you can come and see, by the way, because the mirror is in the air. Some people, they really hold mirror on the patient's soft tissues or on the cheek or on the chin, but I hold mirror, you see, away in the air, so I can move it. So we have now mirror in the air, like this. So the mirror is your eyes. You can move it in a different way. See? I can move it forward, backward, left, right, so that's the way. If I will just place it like that, it will be my support. I'm afraid to fall down, you know. It's like that. And then you're limited with the movement. So the mirror has to be in the air, but your hand has to be stabilized on the patient's zygoma or on the patient's cheek, and you may have some dental chair with a arm support, which will be even better, but still possible without, you see. And now I have to find out the angle in which I can see how bore placed parallel. This is the way, because many people, they make this mistake. They place bore from the very palatal. They control tip of the bore, but this is mainly endodontic angle for the bore placement. You have to place bore parallel to the cingulum, for example, in this case. So that's the way I do that. So this is palatal distal transition. Okay, and that's the view over mesial palatal transition, where I have undercut, and I improve it with a mirror control. I think that's enough for step 1. I will dry now everything. I would like to see from insertion path. Insertion path is like you place your mirror perpendicular to the long axis of the tooth, and I would like to see all my initial finish lines equally exposed. In my case it's fine. I have some small undercuts in proximal sides, but that's fine because I will do my step 2 with a thicker bore, which will be 16 red, and I will get rid of these undercuts, and every transition line will be pretty smooth. Okay, that's it.